Is this how you feel while documenting?
If so, and you're feeling frustrated and burnt out from all that documentation, we have a solution for you before you break your laptop like he did.
Welcome to Scribe2Move. We help therapists focus on patients, not keyboards. Meet our team. Our management team includes Brett Beavers, Chief Executive Officer, Rhea Cherian, Chief Operations Officer, Kristen Yee, Chief Financial Officer, and Aaron Chatham, Chief Marketing Officer. Our mission is to improve clinician efficiency, documentation quality, and the patient experience. Our vision is to create a therapeutic environment that is free of the stress and burnout that documentation often causes therapists, allowing clinicians to have uninterrupted, face-to-face interactions with their patients instead of their computer screen. Our scribes are educated to document with a patient-centered approach. They use appropriate terminology at all times, always maintain patient confidentiality per HIPAA law, act professionally, and uphold a high ethical standard at all times, always striving for excellence. The hierarchy in this company is quite traditional. The organization's structure of power, from most to least influence, includes Chief Executive Officer, President and Chief Operations Officer, Chief Financial Officer, Chief Marketing Officer, Vice President, Regional Managers, Chief Scribes, and lastly, Physical Therapy Scribes. Our scribes work directly with physical therapists during clinical visits with patients, transcribing pertinent information in real time into an electronic medical record.
Scribe2Move specifically targets physical therapy businesses in all settings, including outpatient, hospitals, home health, and many more. We focus on helping practicing physical therapists with their role in documentation. We also target the younger population, such as students who need medical experience, with an emphasis on physical therapy. These students would be the focus of our potential employee base. So while providing students with a chance to gain exposure in the field, we allow physical therapists more time to provide quality care and prevent major burnout from the hardships of documentation. The only competitors we have would be other medical scribe companies, but they do not currently cover physical therapy services. Our company is unique in that it provides services to physical therapists in any capacity. Of course, established medical scribe companies could become a threat if they decide to expand their business into the realm of physical therapy scribing. So why did we create this company? 45 to 71% is the current physical therapy burnout rate, which is due to emotional exhaustion, inability to provide personalized care, and lack of personal achievement. Clinician burnout is a huge dilemma across all healthcare fields, including allied health services. The burnout of physical therapists also leads to the lack of quality and consistent care for patients, and this is the number one factor in being able to provide for our patients. Clinicians have commonly reported that documentation through EMRs is one of the major reasons of burnout, and they require up to 2 hours of documentation for every hour of direct patient care. When the job starts to demand more job resources, this makes it harder for people to reach their goals, including the ability to effectively complete documentation. This is what can tire healthcare professionals and eventually lead to burnout. As for physical therapy, the APTA already reported there aren't enough PTs in the U.S., and by 2025, about 26,000 PT positions are going to continue to be unfilled. The demand on physical therapists is only going to increase from here on out, so we have to take action to prevent overworking with inefficient EMRs and prevent our PTs from burning out. This is where our company, Scribe2Move, can relieve the burnout rate, as we provide scribes to assist with the documentation process while the clinicians can focus on providing the best direct patient care. Scribes have already been seen to reduce physician burnout by significantly improving physician satisfaction, better chart quality, accuracy, and efficiency. This gave physicians more time to spend with their patients face-to-face and allowed them to get documentation done more efficiently within the 48-hour mark. Seeing that this is already working for physicians, the same can be implemented for physical therapists to avoid burnout for the same reasons.
Scribe2Move's goals is to provide physical therapy scribes that will optimize provider efficiency, reduce administrative burnout and burden, encourage provider self-care, and improve patient satisfaction to create a more harmonious and effective therapeutic environment. Scribe2Move services will include a course curriculum to teach scribes how to efficiently, accurately, and effectively document for physical therapists. These courses will include relevant medical terminology, basic physical therapy courses, and documentation courses specific to the physical therapy practice. Scribe2Move will train and hire administrators with a set hierarchy to teach and manage these students. We would also hire chief scribes at each of our respective locations to manage the scribes. This will include on-the-job training, EMR training, and overall supervision. Each scribe must pass a standardized exam and receive their Scribe2Move certification. Scribe2Move will also network to find PT clinics or companies or hospitals that are interested in our services, then undergo contracting with them. And then our scribes would work at these establishments as contractors. Scribe2Move will start in the Atlanta area and branch out to the Metro Atlanta area. Our goal is to go statewide and then ultimately go to the Southeast region. For marketing, our company logo is Scribe2Move with our slogan as Scribes help PTs focus on patients, not keyboards. Scribe2Move will advertise our services at universities, especially science and health departments, to attract our primary market of potential employees, which will be students. Our marketing team will oversee networking at these universities, and they will also be on-site vendors for PT clinics and hospitals. Scribe job opportunities will also be posted on employment websites such as LinkedIn and Glassdoor. And we will also advertise to our potential customers through YouTube or Google.
Scribe2Move will start out with 7 initial job opportunities, including a scribe training coordinator who will be responsible for managing and training our scribes, a software technician responsible for the website and any training websites, software issues that we might have, a medical coordinator responsible for maintaining the relationships that we form with medical offices, and then we will have scribe positions. We're going to start with 3 scribes and then grow that number from there as the business grows. And then lastly, we will have our chief executive positions, including our CEO, COO, CMO, and CFO. We're going to base our office in Atlanta, Georgia, and the software technician, medical coordinator, and the chief executive positions will be based at this office, and the rest can either work remotely. The scribes will obviously be at their medical offices. Here's a chart that lists the estimated monthly and yearly salaries for our job positions. You'll see that some of these aren't listed in the initial job opportunities, and that's just because those jobs will become available once our businesses grow more. To start Scribe2Move, we will need an initial amount of $60,000. This startup cost covers the first 2 months of operation, which includes rent, office supplies, marketing, the website and software creation, and the salaries for the necessary employees that were listed on the previous slide. The startup cost also includes a flex amount of $5,000, which can be saved to go towards the next month's operations or used for unexpected or miscellaneous items that might come up as we open. The monthly operating costs are estimated to be $25,000, but this number could increase depending on the number of employees needed and pending the business growth. So as we get more employees, our salaries that we're paying will get more, and then the monthly operating costs will increase. We've decided that we're going to charge our medical offices $3,000 per scribe, and this covers the salary of the scribe as well as all of the other day-to-day things that we're going to be handling, including interviewing them, training them, setting up the software training, as well as handling health insurance and things like that. We are estimated to break even by month 8, and this was calculated by dividing the fixed monthly cost by profit per scribe.